everyone. My name is Jawad, and I'm an international medical graduate, but currently working at the Heartbeat Clinic, McKinney, Texas. So my topic is like association between red cell distribution weight and maximal oxygen consumption, which is also called like a functional capacity and the delta heart rate in POTS patient, like postural orthostatic tachycardia syndrome or PSWT patients, which is like postural symptoms without tachycardia. So like briefly regarding about the background of the POTS and PSWT, POTS is like an autonomic dysfunction, which is characterized by increase in heart rate, abnormal increase in heart rate of 30 beats per minute upon standing and within 10 minutes of head-up tilt. And so one of the criteria is like increased heart rate should be sustained and consistent, and there should be no orthostatic hypotension. And regarding PSWT, so it is like similar to POTS, but the heart rate is not like greater than 30 beats per minute. And regarding the red cell distribution width or RDW, it's like a measure of variability in cell size, like the red cell size. And regarding the VO2 max or functional capacity, it is the ability of utilizing maximal oxygen during the exercise. And regarding the delta heart rate, it is the difference between the resting heart rate and the maximal heart rate achieved during the exercise. So regarding the objective, so our objective was to explore the association between RDW and the functional capacity and delta heart rate in POTS or PSWT patients. So briefly about like the objective, so there are like several studies which indicates that high RDW or the RDW has some association in cardiovascular conditions, specifically the heart failure. So like it has shown like high RDW is a like a negative predictor value in rehospitalization and mortality of the patients in heart failure. So that was the purpose of our research, to see if there is any association between RDW and dysautonomia patients based on the functional capacity and delta heart rate of the patients. So for that purpose, our method was like we collected 158 individuals, like the random data set uh, with POTS or PSWT patients, and we collected RDW from their CBC report or and from the metabolic stress test or a cardiopulmonary exercise test, we collected functional capacity, which is VO2 max, and the delta heart rate, which is like maximal heart rate minus resting heart rate. So we came up with the result that regarding the demographic, we had 135 patients with POTS and 23 patients with PSWT, and out of them, like 145 were females and 13 were males. And regarding the RDW and association with VO2 max, so we came up with the significance value of 0.087, which is greater than the standard value of 0.05. So hence it proves like there is no association between RDW and the functional capacity in dysautonomia patients. But regarding the RDW and delta heart rate, so we came up with a value, a significance value of 0.179, which is greater than the standard p-value of 0.05. So hence proof there is no association between RDW and delta heart rate. So that was our conclusion. So in dysautonomia patients, so RDW showed no significant association based on functional capacity and the delta heart rate. So, and RDW doesn't have any negative prognosis, or neither it's like a predictor value for dysautonomia patients. So that was our topic. Thank you. And any question? So as I said earlier, like there are several studies which says like high RDW has a negative predictor value in cardiovascular conditions, specifically the heart failure. So POTS is kind of like a pumping failure. So that's why we want to see like if there is any association between RDW and the dysautonomia based on a patient functional capacity, which we collected from the cardiopulmonary exercise test. So, sorry. So like we will do like further research regarding the RDW and any other component. Okay. Thank you.